Hi, this is Dr. Emily Kubat from InspireLifePT.com, coming to you today to talk a little bit about exercise during cancer treatment. There's a few really great reasons to exercise during cancer treatment, and definitely combating the fatigue that a lot of people feel after surgery with chemo and with radiation. Exercise can really help to decrease those feelings of fatigue. I've had several patients that come into my office and they're just not really feeling like they can do anything that day. And we start out with just some slow exercises, warming up on the arm bike a little bit, and then after that they really perk up. They feel like they can do even more once they've started. So I tell people, even if you can just drag yourself out of bed long enough on those bad chemo days to walk a little extra lap around the house, sometimes that can be of help. And then on the good days, getting outside and just even setting small goals for yourself so that you don't get overwhelmed. Setting a goal of walking for 5 minutes. And you get outside, you walk that 5 minutes, and then sometimes you feel so much better that you feel like you can go for 10 or 15 minutes when you really didn't even think you could get started. So just getting started, setting small goals for yourself is so important. And working with a physical therapist and your physician and exercise specialist to kind of just get you started with exercise so that you know you're doing it safely and you won't be harming your body. Another thing that is really interesting that there's been some research about is that if the tumor is still in your body, if you haven't had surgery yet and you're having chemo first before you have surgery, the exercising can help the blood supply get to that tumor a little more symmetrically, which can also help the chemotherapy get to that tumor and really work on shrinking it before you have surgery and, helping to get rid of that tumor, which is a really, really interesting thing that can be done. Exercise is really great. So exercise can also help reduce the recurrence of cancer, which is something that is on every cancer survivor's mind. What if the cancer comes back? But to know that you can do something as simple as walking for 2.5 hours a week, set up a goal to be walking a half hour most days and just really increase your activity that way, and you can really reduce your risk of cancer recurrence, which is great. So there's definitely a lot of health benefits for everybody to exercise, but even some great benefits during cancer treatment, which may seem difficult, but just trying to fit in a little bit of exercise each day. So make sure you're contacting your local physical therapist to get started with an exercise program that's right for you. And be sure to follow me on InspireLifePT.com, my Facebook page, and Twitter. Thanks.